weather. We don't know what's going to happen, but if anything happens, it's supposed to happen, and I think at about 10 o'clock tonight. So we have our weather magician, Dr. Cheryl Pottiger here, who, if you want to know anything about the weather, that's the person to ask. I'm grateful and thankful that you all could come tonight because we have a wonderful panel of presenters that can talk to you about individual services that they can offer to your children in grades K through 12. The way, we've not done this before, we have from 5 till 7 o'clock, and what I'd like each panel member to do is introduce themselves, talk a little bit about their agencies, and then at the end, if you have questions for them, we have note cards on the table if you don't want to pose a question publicly to them. I will compile those at the end and hopefully come up with a Q&A that we can post on our website. And then also, if you want to address those questions verbally with the panel members, you may do that as well. So we have quite a few people here, and at the end of the session, I have asked them also to bring any literature that they have, and they've done that. So we've also have this videotape this evening, so if you know people who were not able to attend, and we had a handful of folks that wanted to come who weren't able to, we can put this on our website and then have folks access this at a later time. So without any further ado, I'm going to have the panel members introduce themselves, talk a little bit about their agencies, and then once we get through everybody, we will open up the floor to questions. And again, if you have a personal question, we do have note cards on the table. Thank you. So, Michelle, do you want to start?
Absolutely. I'm Michelle Millius. I'm from Strawberry Fields. I guess I can see everybody. I'm here this evening to talk about blended case management services, which we offer for children, adolescents, and adult at our program, but I'll mainly focus on the children and adolescents this evening, so if anyone has questions about adult, please feel free to ask. Strawberry Fields has been doing case management for children since 2001. So we've been around for quite a while now at this point in time. We also have other programs at Strawberry Fields. We do ID services, early intervention services, and then adult mental health services also. The blended case management services are services that are available to any child or adolescent who has a mental health diagnosis. That's the first criteria to get open with our services. The next criteria would be having medical assistance or being open with the Center County MHID office for payment. So those are the two areas that we look at first. After that, we're going to look at what services your child is currently involved in or could potentially need to be involved in, and that's where we come in. So our job is to link you with the services in Center County that you may or may not be familiar with. That can look like mental health services, that can look like educational services, housing, food, financial issues. So even when we're in the home and your child may be our identified client, we're going to be looking at your whole family. What does your family need to be successful? Where are you looking to head with your family? What do you want your child to do for the future for their transition out of high school into the adult system? Where for our kids who are transition age, we're going to be looking at secondary education. That can look like a VOTEC, that can look like college, that can just look like getting a job. So what that looks like, and we're there to help educate you on those options. We're not there to make decisions for you, but the system can be extremely difficult to navigate and to know what's out there, and that is our job, to help educate you on your options so that you can focus more on your family and not have to spend all that time trying to figure out what's available, how you get it, where's it at. We also will coordinate those services for you. So if you have an IEP in school, you might have an outpatient therapist, or you may have mobile therapy. You may be working with other outside providers. We're going to make sure everyone's on the same page, because that can get really overwhelming on a day-to-day basis, having to make a zillion phone calls to make sure everyone knows about a meeting. We're going to take that over for you or assist you with that. We don't want to take over anything that you feel comfortable doing. We just want to make your life easier. We also have crisis component for our blended caseworkers, so 24/7 you can access one of our workers. If your child's having a difficult evening and you're not sure what to do about that, you can call the CAN helpline at the Meadows. They will link you with our services. We'll assess the situation. Sometimes it's just a matter of us talking to you guys and reassuring you that you're doing what you need to do. Sometimes it can be looking at the safety of your children or your family. Does someone need an inpatient? Does someone need a referral the next day to a different service? So just supporting you in that time, which can be pretty stressful in the evening when you feel like everyone is closed and there's no one to ask questions to. We're available to do that. We're also going to advocate for you and your family, so making sure that you go to a psychiatric appointment, that the psychiatrist is listening to what you're saying, that the psychiatrist is listening to what your child is saying. Sometimes when you walk in, everything looks like it's going really well, but maybe Monday through Friday, things aren't going so well. So making sure that the providers that you're working with are hearing what you're saying and helping support you to make sure that that is happening. We also, for any of our families that are open with our children's program, once a month we offer a parent support group. It is completely informal. It is for our parents that are open in the children's system to come together and to just support each other. We bring in presenters that they request. We have a picnic once a year. It's a time for people to realize that there are other people in the community that are facing the same thing you are, and it's a good resource to learn of other options. And quite honestly, our parents are wonderful, and they know more than we do half of the time, so we are able to learn from the parent support group too about programs that we may not be familiar with. I think that that's pretty much everything. If you guys have any questions, please feel free to ask this evening, or you're welcome to call me. I have a paper up here on the table. You can take my number and give me a call, and I can talk to you more specifically in relation to your child.
Hi, I am Marianne Zimmerman with Center County Children and Youth Services. Typically when people hear where I work, they're not always anxious to see me. So it was really important for me to come tonight because I think people need to understand what Children and Youth does. While we do sometimes remove children from the home, our goal is to keep them in the home whenever possible. Child welfare is a two-tiered system. 30% of the time we spend on abuse investigations. So we do all the abuse investigations for Santa County. The rest of our time, most of our time, is spent on general protective services. That's providing supports and services to the families in their home to help them keep the children there. Those are those situations that really don't rise to the level of abuse or neglect, but we want to make sure that that doesn't happen. This right now is such a stressful time for parents. You have parents that are working and they still can't afford to put fuel oil in their tank, pay their electric bill, and pay their rent every month. So we are looking for how can we support the family, what kind of services are out in the county that they can access if needed. So we do spend a lot of time with the families. If there are risks to the children and we open them up for services, we do a family service plan looking at what those risks are. And we ask the family, we'll say, these are the risks for your children. What can you do? How can you help us reduce or eliminate those risks? So it's not like we're coming in there saying you need to do, we're saying these are the problems, but how can we help you reduce those problems or eliminate them so that your children can remain with you? We make referrals to other agencies. We'll do, when we open a family up, we do an intake to see what services and supports are needed. Sometimes people can be helped in a very short period of time, in less than 60 days. Other times we open them up for a longer period of services. We have, in Center County, we are very fortunate. We have a lot of resources available for our families, and our agency contracts with some resources that go into the homes. Not other counties have that. So for our families that do not have transportation, but really need some help, maybe with child development or parent-child relationships, we have services that we will provide free to the families. They will go into their home at a time that benefits them. We'll work around the family's schedule. So if you have a child that's in sports and in all kinds of other things, we don't want them to stop doing that. We want to find a time when it best meets that family's needs to get together to help support them. So I think it's, as I said, for me, it's important that people understand that we are not just there to remove children. We really are there to help and support the family in any way possible.
Hi everyone, my name is Leslie Nichols. I'm the VHR supervisor at NHS Human Services. Please bear with me, I'm going to be talking about several programs that I'm not in charge of, so I might screw up a little bit. What VHR stands for is Behavioral Health Rehabilitation Services. This is a program designed for children ages 3, sometimes a little bit younger, maybe 2, to 21 if they're still in school, to provide for their mental health and behavioral health needs. It's a medically necessary program, and what that means is that we require a psychologist or a psychiatrist recommendation for the service. And then there's this long process we have to go through to get approved to the state. Included in that process, there is a master's level clinician. It could be either a mobile therapist or a behavioral health specialist. And their job is to initially go in and do an assessment of the situation, whether it be in the school or the homes or daycares. And then if they feel it's necessary, they come back and we have a discussion about whether or not a child needs more interventions. And we have a bachelor's level position or service called therapeutic staff support. What that does is they follow the treatment plan that the mobile therapist or the behavioral health specialist utilizes to address specific behavioral health or mental health services. And that process is authorized for usually 6 months. And then, if we need it longer, we can do that. Go before managed care companies again. Our program here in Center County offers an after-school program and a summer program called Stepping Stones. It's for children who are on the autism spectrum disorder, and it is a socialization skills training program. They service children ages 3 to 14, like ages 3 to 8 in one group, and then 8.5 to 9 to 14 in another. So hopefully, we're working on that for the summer right now. We do offer, although it's not based out of this Center County office, for adults, it's intellectual disabilities. What that is, they provide direct support for people to help adults who have IDD issues with community inclusion. We also, actually in this county, offer adult autism waiver, which is community inclusion for adults with autism. So what they do is the bachelor's level staff will go and help them with community issues, and then they can have a clinician and their position is called behavioral specialist shaping something. Cannot remember that because I don't take care of that program either. So what they do is they kind of help create a treatment plan or a service plan for the adults with autism to kind of follow. We do offer in this program, this area, therapeutic family care, which is just kind of what it sounds like. It's a therapeutic family that provides care to children with mental health and behavioral health needs. These parents, or therapeutic parents, are trained. They get 40 hours of pre-service training. They go through a pretty extensive pre-service, I hate to use the word investigation, kind of like an investigation. They have to go get clearances, they have to have a family study done, a home profile done, you name it, it's a very lengthy process. So before they can become the surrogate parent, they go through all this training, and then they're taught to work with the kids. With therapeutic foster care, they actually have a program coordinator, and they go to the home every 2 weeks to help the families and the biological families or adoptive families and the children, and they have a program specialist, which is a master's level clinician to work with therapeutic issues. Finally, we have the NHS Autism School. It's located out on Acato Drive. We will be moving soon, just so you know. They provide educational instruction. They have 2 classrooms right now that are for autistic children or any children on the spectrum, and they have 2 emotional support classrooms. One is specifically designed for adolescent females. It's called Building Bridges, and I'm not exactly sure because I don't run that program either, the dynamics of the program or the instruction in that program. So that's kind of us in a crazy little nutshell. Okay? Lots of services.
Okay. I'm not Josiah. Josiah could not be here tonight. My name is Erin Strohmeyer, and I'm a therapist with SunClear Child Services. So I'm going to do the best that I can as well, because we have a lot of services, and I'm more familiar with some than I am with others. But SunClear provides a pretty large variety of services, ranging anywhere from early childhood all the way through adult. So I'm going to try to focus just on the ones that pertain to children in the Center County areas tonight. We're headquartered in Phillipsburg, but we also have satellite offices in Coalport, DuBois, St. Mary's, Clearfield, and Punxsutawney. We also service families in the Blair County, Cambria, Center, Clearfield, Elk, Huntington, and Jefferson counties as well. And SunClear was established in 1980, so they've been here long before I was. So I'm going to start with our services kind of from the least restrictive to more restrictive services, and starting with our Head Start and Early Intervention program. So that's providing educational and developmental programs for young children and their families. It's kind of a combination of preschool services and in-home services. And that can include early Head Start, which is from pregnancy to 3 years old, pre-K counts Head Start, which is 3 to 5 years old, early intervention MHMR, birth to 3, early intervention education, which is 3 to school age, and then we're also run a time-limited family reunification program, and this is for family group decision-making for families who are involved with CYS. So I know that SunClear does that quite a bit. We kind of join in with other programs and provide support in the community. For any referrals or information, you want to contact Leanne Whitaker at the main line, which is 814-342-5678, and her extension is 2233. And then we move into our behavioral health division. And so this is services that are strength-based programs for children and families that have a behavioral and emotional focus to them. We provide for children PCIT, which is Parent, Child, and Interactive Therapy. It's more of a current therapy, and I know it's coming into SunClear. We're offering it at the Phillipsburg office location and the Clearfield office location. But this is directed play therapy with the parent and the child, and the therapist is observing and directing it through two-way mirrors and microphones. And so this is based for children with more behavioral needs. We also are offering mental health outpatient services for children and adults, which can include individual, family, collateral group, and psychiatric services offered in our Center County area. The office is in Phillipsburg, but we also contract with school-based services so that we can come into the school and provide outpatient in that setting as well. We have a Maintaining Strengths program. This is a short-term treatment approach, about 24 weeks, where the main focus is on family systems and family strengths. It's kind of a combination of family and behavioral therapy. And then we also, like NHS, have our BHRS wraparound services, which is called our CHAMPS program. But that same idea, that wraparound approach that's supposed to kind of wrap around the whole child and the family, to include services in the home, community, and or the school. And so many people are familiar with the TSS or the therapeutic staff support, the BSC, and the MT roles. So just being able to, based on what the child and the family need, to be able to support behavioral needs or emotional needs or a combination of the both with master's level and bachelor's level staff. And it can be run as a 6-month cycle, and then there's also brief treatment, which is like a 36 or 39-week cycle. Is it 36 weeks? So, and then we have our most intensive level of services is our family-based program. So family-based is for clients and families who are experiencing serious emotional health with the risk of being placed out of the home. And they can provide crisis services and family-focused therapy. It's a team-delivered program with 2 therapy staff that come into the home, community, or the school settings. And again, it has that on-call 24/7 crisis coverage. For those referrals and information, contact Tammy Cardali. Again, the main line, 814-342-5678, extension 2452. I also have lots of brochures and information and can answer the questions the best I can if you guys have any. So thank you very much for your time.
Okay. Well, these ladies have made my life a little easier because we have a lot of the very exact same programs. I'm going to talk a little bit about a couple programs today. First is BHRS, and like both of these two said, mobile therapy, behavior specialist, TSS, we go, or actually Center County does not currently provide TSS. That's why I seek these two out often when I need help. But we are running on the brief treatment model right now, which is a 36-week off period. The families can make the referral by either contacting my program, I have my card up here on the table, or contacting our central intake line, which all that information is on the table. Just like these ladies said, wraparound approach, we go into the homeschooling community, we meet with other providers, develop a treatment plan, and work off of that for the 36 weeks. That's kind of BHRS. I know you've heard a lot about that tonight. We also have our family-based program at UCBH. Ashley Rank is the program manager, and her information is on the table as well. Our family-based team is just like what these guys had said. It is a team approach, recovery-based. The team of 2 goes into the homeschooling community and is working with the families to prevent out-of-home placement. And there's a lot of really great information she gave me on this sheet. Family-based, again, team-delivered, recovery-oriented, intense, comprehensive service that's designed to assist families with caring for the children in the home and maintaining that family structure and environment. There's some criteria these kiddos need to meet in order to have that service, and all of that information is up here. Also, if you have any questions, feel free to contact any one of us at the program. We also have outpatient therapy services, medication management services at the Center County office in Bellefonte. We're at the Match Factory. If you haven't been there, I say come on down. It's beautiful. We're so excited to be there. That process, making referrals, very simple as well. You call our central intake line. They can set all of it up, get it scheduled for you. Or you can call the office directly, and we can assist with that as well. Did I miss anything about outpatient? PCIT. Ashley and myself actually will begin that process next month to begin providing parent-child interactional therapy as well in our office. The office is ready to go. We're getting the training and be up and running shortly. Any questions, please feel free to ask or give me a call. And I am actually going to let the expert on partial talk about her partial program.
I'm Whitney Bittner, Program Manager of the UCBH Partial Hospitalization Program, or PHP. So what partial is, it goes from, there's outpatient, wraparound, family-based, and then partial. So partial is a more intensive service. So a child, school-age child, we take kindergarten through 12th grade, that is having behavioral or mental health difficulties can be referred to our program. We are a Monday through Friday, 8 to 2 program. So the child would come into our building and receive a comprehensive services within our program. I like to explain the day as half therapy, half education. We have a special ed certified teacher, and so she is able to follow all IEPs if a child comes in with an IEP. And then the half a day of therapy consists of group, individual, and family. We have a psychiatrist that will see a child or the children once a week and review any medications, do refills, connect with families. And they're also there as a consultant if a child would need more services, more intensive services. We provide lunch to the children. We have special behavioral plans. We have program-wide behavioral plans, but then we also do a lot of individualized since we have children coming in for all different types of reasons. So a lot of individualized behavior modification and working with parents and a lot of guidance counselors and anyone that we can get to help us out. We work closely, a lot of our children have case managers already, or they have FIX or CYS, so we try to incorporate every service provider for the children to come in. We do bi-weekly treatment team meetings, so we can all come to the table, literally, and talk about how the child's doing, and then immediately start discharge planning. Part of our service is that we have case management, and we're looking for the most appropriate step-down service for a child after they're leaving partial, because we are a more intensive service. So whether that be if they need a case manager, or if it's just outpatient, if we're looking at brief mobile therapy, or if we're looking to have something more intensive. So discharge planning really starts right at the beginning, so we can support the child leaving our program and going back into a least restrictive environment. A school, parents, a PCP, a neighbor, a friend, anybody can refer to our program. We are funded by insurance. A child doesn't have to have medical assistance to come to our program. We will help that family apply for it and help them get that. Just because it is helpful whether a child has co-pays on their commercial insurance, or transportation or medication. If they need medical assistance, we take care of that for the family. Brochures, business cards, and pens, all up here if you have any other questions about partial. Thank you.
So I'm Val Barner, I'm the regional director for UCBH, and I'm not sure if Mary introduced herself.
Oh.
But this is Mary Walsh with UCBH as well, so the three of us are from UCBH. One thing Whitney didn't talk about in terms of partial is we do a lot of transitioning back with the school, homeschool. So Whitney really works a lot with the homeschool. We've had teachers come in and observe the child for the day, part of the day, so we really work on that for partial. What I'm going to talk about is kind of outside my box a little bit, is our crisis program. We have Can Help, which is the Center County Crisis Line, and Can Help is available 24/7. They provide phone and mobile crisis, so if a family is in need or wants to talk to somebody, they can call anytime, 24/7. If there's some concerns about stuff that's going on in the home, maybe some intervention, a counselor can come out to the home and work with the family. And one of the really great things that they do, they do outreach to our blended case management providers and do the on-call for them and reach out to them. But they also then will do a lot of follow-up. So if the individual, the child, the family member is involved in services, they will do follow-up and let those service providers know. They will also help the family connect to services. They will work with them, give them options, and then they will follow up with the family if they're having difficulties reaching out to providers. They will assist the families in doing that. In addition to all those things, they do a lot of work with the schools. So if there's some kind of event that happens with the school district, they'll do outreach with all the various schools. If there's a tragic event that happens with a child or a teacher in a particular school building, they'll also do outreach and provide support to schools and families of the schools. Amy Luce is the Center County Crisis Supervisor, and her information's here. So if you have crisis questions, I will try to answer as best that I can. UCBH is the sibling to the Meadows, which is our inpatient facility, and we are the outpatient provider to that service. So, thank you.
Hi, I'm Christy Gregg. I work at PATH, also known as PA Treatment and Healing. We have 3 independent programs that I'll speak a little bit about. We have an alternative education school program, which is kids can be referred anywhere between 6th and 12th grade, but they have to meet specific criteria, and the referral comes from the school districts. Our goal for them is to get them in, address the goals that they're there for, whether it be maybe continuous disruption, disrespect to school authority, truancy, drug violations, aggressive behavior, maybe having weapons on school property. They're some of the things that kids are referred to our program for. We develop an ISP, which is an individual service plan when they're in our program. And basically our goal is get them in, get them what they need, and get them back to the public school. We have a normative systems where we do a level system within the school program and work on behaviors. We do psychoeducation. during the week. It's usually after lunch. And we also have our after-school program staff, which are master's level and bachelor's level therapists available to the kids if they would need that throughout the school day. But we are funded through the school districts. So that's our one program. We also have a drug and alcohol program, which we provide individual and or group therapy to adolescents as well as adults. And we recently just hired a drug and alcohol counselor, so we're getting that program kind of built back up because our previous counselor resigned. So that's funded through medical assistance, and like I said, it's for adults or children, and anybody can call and make that referral for that service. The last service I'll kind of talk a little more at length about, it's our intensive adolescent program. It's an after-school program, and it's funded through medical assistance. It's for kids ages 11 to 18, and it's mainly mental health, and it's an intensive program. So maybe if kids were not so successful in maybe mobile therapy or behavior specialists and they need a more intensive service, the kids come in, they usually have an evaluation by our psychologist, and the recommendations are made whether they're appropriate. It's usually the kids are referred anywhere between 16 to 18 hours per week. While they're in our program, we use cognitive behavioral therapy approach. We kind of follow it. The kids usually come in, it's kind of hard to see, I'll leave it lay on the table. It's called our path of life. They usually come in and they're detaching, disconnecting, or destructing. They're exhibiting some kind of behaviors, and we want to get them out of that. With some assignments, we want them to find it, feel it, face it, forgive it, and then forge ahead. We call them our 5 Fs. So we use this cognitive behavioral approach with all kids. The kids are usually authorized in 6-month increments, and then obviously we decide at 6 months, have they met their goals, are they ready to move on. We do individual therapy, family therapy, and group therapy. The kids, a typical day, we pick them up at school. We have transportation, so we pick them up after school during the school year, take them to our facility. We have usually 2 groups per evening. They learn social skills, some independent living skills. They're assigned a caseworker, and that caseworker is responsible for providing 2 individual sessions per week or more if needed, as well as a family session per week with the family. And it's developed similar to BHRS. We develop a treatment plan, and the caseworkers work off the treatment plan that the clinical supervisor develops to meet the goals of the kids. And then we take the kids home in the evening. We also provide them with dinner. So they usually arrive at our center anywhere, depending on when they're dismissed from school, between, I want to say 3:30, 4 o'clock, and we usually leave our facility around 7 to transport them home. So it is a long day for the kids, and a lot of the kids, feel it's a long day, but it's been very successful. So I'll leave some pamphlets up here for all of our programs, and if anybody has any questions, they can feel free to ask me.
Hi, my name is Janine Burris. I'm here representing the Juvenile Probation Department for the county. The information I'm going to give you about the probation department is very specific. Obviously, children that come through need to be charged with either a misdemeanor or a felony. Children starting at age 10 can start with the system. So if you think about it, we're looking at sometimes elementary age kids. I think a lot of people think, well, it's, high school, it's these 17, 18-year-olds. And that's not the case. We are seeing kiddos that are a lot younger, unfortunately. Children can be charged with just a summary. If they are, they will head to the magistrate's office. So they do not come and see us at the court of common pleas. So it has to be a misdemeanor or a felony. We do our best to utilize the county's diversion program, which is called the Youth Aid Panel. That's a program that can be referred, that the juvenile can be referred to by either a police officer, a school resource officer, my supervisor. If a child is they may have a misdemeanor and they may come in, but it may be something that's really out of character. So we can utilize the Youth Aid Panel. It's a diversionary program, as I said. It is comprised of a panel. There is one in Bellefonte, one in State College, a panel of volunteers in the community where the child and the parent come in. The child has to totally take responsibility for what they had done, and they are set up with a mentor on that panel, and they come up with a case plan where they need to fulfill requirements. It might be community service, it might be an apology letter, but once they complete that, the process stops, and so there's no record of a petition or any charges. Everything goes away, and everyone sort of moves on with their life, and it's a blip on the radar screen. So the Youth Aid Panel is a wonderful program. It is about a 98% success rate. So at any point that we can use that program, we do, as do the school resource officers and the police officers around the county. Misdemeanor or felony, they're going to come to us. There is a court process. There are different types of probation, but once a kiddo is deemed to be on some type of supervision, they will work specifically with the probation officer. We have 5 juvenile officers in our department, and we do have some that are assigned specifically to the different school districts. I am not here in Bellefonte, but I am here representing the Bellefonte juvenile probation officer. So we work very closely with the schools, with all of the people that you see here. We take a team approach. We work with the parents. We have a case plan. There are specific court requirements that the juvenile will have to do. It may be community service, it may be an apology, it may be restitution. But along with that, we develop everything that we can so that kiddo can successfully complete their supervision and move on. Their record can be expunged at some point, which means fingerprints, photographs, everything associated with what that kiddo did goes away. Because the juvenile system is set up to be rehabilitative, not punitive like the adult system. So if there's any other specific questions or sort of what-ifs concerning probation, feel free to ask me. I'll answer things the best that I can.
Good evening, everyone. My name is Jen Chessie, and I'm from the Base Service Unit, also known as Mental Health, Intellectual Disabilities, Early Intervention, and Drug and Alcohol Office. It is a mouthful, yes. I wear several different hats with the county, and I really want to thank my panelists for being here because they made my presentation very, very easy. Before managed care came aboard, which is community care behavioral health, everything was always funneled through medical assistance. So the base service units in the counties or joinders was sort of like the hub. Everybody had to come through us. We would refer out for services and things along those lines. About 8 years ago now, 9 years ago, medical assistants decided to bring in a BIMCO, a behavioral health managed care organization that would kind of manage the dollars for behavioral health services, which meant you don't have to come to the base service unit necessarily for your services. So they can refer directly out for case management, a higher level of case management, or blended case management, and things along those lines. So the base service units have kind of sort of taken and been revamped a little bit. So the first hat that I wear is I supervise our administrative case managers through the county. Basically what that means is if you have questions, not sure about certain services, things along those lines, you can pick up and we have somebody that will answer the phone during our regular business hours of 8:30 to 5. So if you just have questions, you're going to get someone who's going to maybe be able to direct you in the right direction. If you're not sure what kind of services you need and things along those lines, they can do that. If you feel you do need a case manager, we have what are called administrative case managers, and that is who I supervise. They're kind of like your ground level case management. They will meet with you for the intake. They will help refer you out for services, coordinate those services, and then basically just meet with you as needed or on a yearly basis to update our financial liability. That is a state requirement that we have to do. For children and adolescents, we take in the parent or guardian's income information. Again, everybody's talked about, linking up with medical assistance, referring out for services. We do have Dr. Boswell on staff, who is a psychiatrist that will see children and adolescents. We also offer adult psychiatric services as well as adult case management at all levels. So Michelle has already touched base on our blended case management. We actually offer that at the base service unit as well. That's one hat. Now my other hat is CASP, which is our Children and Adolescent Service System program. Back in the early 80s, the state realized that there were so many, as you can see, children and adolescent services, and counties were very disjointed. Providers maybe weren't talking to each other, kids weren't getting the best services and supports that they needed. So they created CASP. Each county and joinder then has a CASP coordinator that is supposed to have, their finger on the pulse of all the services. But as you can see here in Center County, this doesn't even really touch on kind of what we have here. So it is a very daunting system. Even though I am employed at the base service unit, CASP is separate from the base service unit in a lot of ways. You do not have to be open with the county in order to come through CASP. We have a separate CASP release and a separate referral system. So basically what that is you're going to say you're having questions, a school can refer, anybody can refer to CASP. What that looks like is pretty much a group of providers, very similar to who is sitting here this evening, and you come in, this is what's going on, we've had a lot of great interactions with the schools coming to CASP, and here are the behaviors that are going on, what services and supports would best meet the child, family's needs. One of the jobs that I have to make sure is we are looking at the least restrictive and most appropriate services. They've touched on this a little bit. There is like a hierarchy to the services. If a child is having behavioral issues in school and the family says, we want them out of the home, we want them in a residential treatment facility, which is locked down. Sorry, they're not locked down, they're a secure facility. There are none here in Center County. Most people have to travel hours away to get to one of those. We're not going to jump to that first. We're going to try BHRS services or family-based. So we need to look and make sure that we're providing the most appropriate service. That is pretty much what CASP does. A lot of people think that you have to be open with the county in order to do that, and that is not the case. We have ongoing CASP meetings every 2 weeks, or more often as needed as referrals come in. So a lot of what we use CASP for is, Michelle may have someone that one of her case managers are working with, and they're just really struggling. They've utilized numerous services. They'll just discuss them at CASP as long as we have a release, and they'll be able to maybe think outside the box a little bit of something we haven't thought about, family group decision making, respite services, things along those lines that might be utilized. I know that was a lot very quickly, so if you have any questions, feel free to let me know.
Good evening. My name is Paul Zimmerman. I also work at the Mental Health, Intellectual Disabilities, Early Intervention, and Drug and Alcohol Office. I'm here specifically to talk about the intellectual disabilities part of the office. The Intellectual Disabilities Office in Center County is kind of the funding agent for all ID services in the state of Pennsylvania. Every county has an office, or several counties could join together, and they would have an office that would oversee funding for intellectual disabilities system for services in that area. So our office is the funding agent for Center County. To register for ID services in Center County, the easiest way is to call our office and ask for me. Again, my name is Paul Zimmerman. I handle all the intakes for the ID unit. And when I meet with you, I'll be looking for 5 things that I'm looking for ID eligibility. First thing is a diagnosis of what used to be known as mental retardation that we now call intellectual disability. And that's comprised of 4 different things. First thing is an intelligence score on a standard test like the Wechsler or the Stanford-Binet, something like that. The magic number we're looking for is 70, but I do have to allow 5 points for test error, so I can look at anything up to 75. The other test I'm looking for is a test of adaptive behavior. Common examples of that are the Vineland Adaptive Behavior Scales or the Scales of Independent Behavior, or the Adaptive Behavior Assessment System. Some of the examples. That needs to show delays in adaptive functioning in at least 2 areas. Adaptive behavior is anything and everything that we do during the day. It can be as simple as getting out of bed on time, using the restroom independently, budgeting your money. It can be as complicated as that. All of those things are considered to be adaptive behavior. And one of the essential features of mental retardation or intellectual disability is delays in adaptive behavior. So that's what we're looking for on that test. There are 2 other things that I'm looking for eligibility for ID services. One is that the intelligence test is considered to be valid. There are some reasons that an intelligence test wouldn't be valid. A good example would be if you give the Wechsler or Stanford-Binet intelligence test to a nonverbal child. Those tests have verbal components. Your score will be erroneous if you give that test to a nonverbal child. Likewise, if you have an individual with significant mental health, say they have schizophrenia or something like that, and they're actively hallucinating while you're giving the intelligence test, that score is not a real good indicator of what their true intelligence is. And we would look to make sure that we retest that individual after you get the mental health symptoms under control. So the last thing that I'm looking for eligibility requirements for intellectual disabilities is that the onset of disability has to be during the developmental period. Now, if you look at the Diagnostic and Statistical Manual, or the DSM, it's actually before the 18th birthday. The Office of Developmental Programs, which is our state office that oversees all the county offices, has actually extended that to the 22nd birthday. And that actually allows us to serve individuals that have traumatic brain injuries between that 18th birthday and the 22nd birthday. So that's a very wonderful thing that we can do for those folks. It allows us to serve them. The next thing I wanted to talk about was the role of the supports coordinator. And as soon as somebody is determined to be eligible for ID services in the state of Pennsylvania, they are offered their choice of supports coordination organizations and then are assigned to a supports coordinator. The supports coordinator has three main roles, but I always add a fourth one. There are three roles that all of our literature say that they do, are locate, coordinate, and monitor. What they mean by that is locate needed services. So we're going to meet with the individual, come up with some idea of what they need, and try to locate those services, and then coordinate them amongst all the team members when they are in place. And the last thing that they're supposed to do is monitor services in place and make sure that they're meeting the individual's needs. The other thing that I always add is that the supports coordinator is to be an advocate. They are to advocate for the individual's rights, their safety, all of those kinds of things as well. So that's an additional role of the supports coordinator. Now for your students who may be open in the ID system, we do like to come to IEP meetings. That way we're involved in just kind of keeping up with what's going on at school. And it is another opportunity for us to advocate for the child's educational rights as well. So that's something that we can do. But we do need to be invited to the IEP meeting before we can come. There is quite a litany of services available in the ID system. Typically for folks still in high school, we fund things through our family-driven program, and the two main services that we look for that folks typically use are called respite, which is really a break for a caregiver. Think about this as an example would be a family that wants to go have dinner and doesn't want to take their child or children along. That's respite, that's a break for the caregiver. And we can pay for that in a daily rate, or we can pay for that in a 15-minute rate. But that is a service that we can pay for. We also pay for family education or training. For instance, we've sent folks to the Down Syndrome Conference, we've sent folks to APERT Conference, things like that, autism conferences, things like that. We typically pay for the registration fee and lodging, and the families on their own for the rest of the costs. We pay for quite a few other services for folks once they get out of school. We pay for things like day programming. We have a couple different options here in Center County. Skills of Central Pennsylvania runs an adult training facility which focuses on early academic tasks, basic reading, basic writing, toileting, those kinds of things. They also have a pre-vocational center where folks are working on vocational skills through repetitive work and those kinds of things. Sunny Days is another option that we have, and they run an adult training facility as well. So we can pay for day programming. If your young adult is looking to be competitively employed, we can pay for supported employment as a job coach to help the individual learn the job, keep the job. We can pay for that. We can pay for respite for folks once they get out of school as well. There are quite a few other services, but in order to keep my presentation short, I won't go over every one. There's a couple different ways that we fund services. One of them is through our state-only money that we call base funding. This is very scarce. We have about 400 folks open for ID services at this time. To make the math easy, say we get $1 million in state-only funding. That's, what, about $2,000, $2,500 a person. Now, half of those folks are enrolled in one of our Medicaid waivers, so it's really about $5,000 a person is your average. But we do have folks that we pay for their residential placement out of that money, and some folks that go to their day program that we pay out of that. So the availability of that is typically quite scarce, but we do the best we can with it in order to meet as many needs as we can with that funding. Now, the other ways that we fund ID services are through Medicaid waiver programs. We have two. One is called the Person Family Directed Support Waiver. There's a funding cap on it every fiscal year of $30,000. It sounds like a lot of money. And it will pay for a fair amount of services. It would pay for example, it would pay day programming 5 days a week. Most folks go about 6 hours a day. And it would pay for your transportation to and from, and maybe a little bit of respite. You could do all of that with $30,000 in a fiscal year. But if you needed residential services, like a group home or something we call life sharing, which is a host family type of residential service, we would need to fund that through the consolidated waiver, which has no funding cap on it. But it's also a lot harder to get into. And when we have an opportunity to put somebody in that waiver, typically we have quite a few folks to look at and only have one opportunity to put something in. Two other things that I need to mention about ID services. We do have an individual support plan for everybody who's open for services. This, you can think about it as a student in school, the individual would have an IEP, which is very educational and focused, as it should be. The ISP, or individual support plan, is person-focused. We're going to have information on health conditions, on medications, health safety information, like can the individual cross the street by themselves, do they need to be watched around poisonous substances, that kind of thing. There are going to be outcomes, which are the same as the measurable annual goals in the IEP. And the very last part of the ISP lists all of the services that the individual is authorized to receive, the number of units, and the cost of the service. The last thing that I want to talk about ID funding is how we plan for ID funded services. We use a document called a PUNS form. It's an acronym that stands for Prioritization of Urgency of Need of Service. That's a form that we can fill out. It has to be filled out at least once every year for somebody who has an unmet need, and we plan for things up to 5 years away. But if your needs change, if there's a drastic change in your family situation or something like that, that form can and should be updated anytime something changes. Now we look to put folks into the waiver, we have to look at the folks on that PUNS. There is you might hear of a waiting list, which is kind of a misnomer because the PUNS form, which is our planning tool, like I said, kind of groups folks into categories of need based on how soon you need services. There are 3 categories, like I said. Emergency is the highest category. It's folks who need services within the next 6 months. And when we look to put somebody in one of our waiver programs, we have to pick somebody who has an emergency need or that needs services in the next 6 months. That's all I'm going to tell you about ID-funded services. But Leslie from Northwestern did mention that they provide autism services, and I wanted to briefly touch on the autism waiver. The autism waiver is a DPW waiver, a lot like our Person Family Directed Support or consolidated waiver. This one is administered directly by the Department of Public Welfare, and we do nothing with the autism waiver here locally in Center County. The eligibility requirements for the autism waiver, you have to have an autism spectrum disorder, and I believe that includes Asperger's, Rett syndrome, childhood disintegrative syndrome, and what? Oh, and PDD-NOS. Then you also have to have Medicaid, and you have to meet a level of care where basically without services and your natural supports in place, you would meet the requirement to be served at a state center. It's they call it ICF ORC level of care. So those are the requirements to get into the autism waiver. In order to apply, you actually need to call the Bureau of Autism Services directly, and the best way to do that is just Google PA Bureau of Autism Services, and then you'll find their phone number on their website. So, thank you.
We have one more presenter this evening, and this was kind of came from word of mouth, and I will introduce Ms. Kim Bennett. Thank you for coming. I think it was a parent that actually told you about the session this evening. So welcome, and tell us a little bit about your services, please.
Well, we're just new. We're called the Journey Center, and I have Jessica Delancey and Jenna Scanlon and Beth Updegrove, all master's level instructors. We are going to be providing services for children with autism and other intellectual disabilities in the area of applied behavior analysis therapy. I'm also a board certified behavior analyst, so we're hoping to also fill some of the needs. I know that the Stepping Stones is up to age 14. We're hoping to expand that for the older kids, as well as just to see what the needs are for direct therapy. We will be a private company in which we will also be able to bill insurance companies for our services. So we're really excited about just getting this up and running. We're just on the ground floor and wanted to just get the word out to see what kind of services are needed in this area, to see if we can design our program to meet those needs specifically for the kids. And we're not going to stop at the child level, but we would also be going into an adult level. That's our dream, or phase 2, to actually offer some support to adults, because I know that's a great need throughout Pennsylvania. So, but I thank you for the opportunity tonight to be able to share that. And if you have any questions, we do have a flyer that's up on the table and has information about our program and what we are the services we're going to be offering. Thanks.
I'd like to open the floor up to parents, teachers, administrators, if they have any questions. We actually have an advisory panel of folks that meets once a month, where we have a group of parents, teachers, administrators, special ed teachers, and general ed teachers. Mrs. Gwen Steiner is actually a parent who sits on the committee who helped to organize this, so I'd like to thank her for doing that this evening as well. I will open this up now to anybody that has specific questions for the group, so that we can take a little bit of time and maybe have a facilitated discussion. We talked a lot about terminology. The different agencies have different terms and different things that they discuss that are pertinent to different types of disabilities. So if you have specific questions, anyone in the group, feel free to address anyone here at the panel. And as I said, we also have index cards, and I will collect those at the end of the session for anyone that has specific questions. So I'll turn that over to the group. Does anyone have specific questions?
So I'm going to ask if you would elaborate. I think, Whitney, you had mentioned initially medical assistance, but I don't know if anybody else can. Because I think that there's a lot of families who don't always have medical assistance and don't understand how to access that, because their financial means may be above what the limit is. So
we find that is common with a lot of the families that come in. They say, we've already tried it, we make too much money. So what we say is that any child under the age of 18 in Pennsylvania that has a mental health diagnosis will qualify for medical assistance for themselves. So we still have the parents apply. They still have to give it's the income, they still have to give proof of that, but once a child comes into our program, they will see a psychiatrist, have a psych eval done, and that means they'll get an Axis 1 diagnosis. So we're able to submit the form for the family with the psych eval that we have, and that child will qualify for medical assistance. As long as that parent is keeping up with signatures, I think it's 6 months or years signatures, that child can keep that medical assistance through adulthood maybe, yeah. So I know a lot of families are like, we've tried it, we can't do it, but a lot of children are eligible for medical assistance based on mental health need.
Okay, I have a question.
question. What if you already use services, like my son already has his own psychiatrist, we also use a cognitive therapist, but I would really like to get him into more things where he could learn more about socialization skills and being integrated more into the group where he's not always the odd person out. So how, like, what agencies would I contact to get him help to do that? And he's 13.
I mean, I'll jump in.
I can give you our card and maybe talk to you a little bit privately if you want about the specifics. 'Cause
Okay.
He may be appropriate for our program. I'd have to ask some questions, specific
Okay,
questions.
only because like you're talking about your own group psychiatrist where we already have people in place that he trusts, and it's so hard to get him associated with somebody that he attaches to and trusted. To pull him out into somewhere else would be a nightmare.
And we have children that attend the partial program that continue with the psychiatrist that they had
Okay.
prior to coming into our program, and that's fine.
Yeah, we still offer the service of them meeting with the doctor once a week. But you're right, a lot of children make a bond with somebody, and you don't want to lose that relationship. So we've worked with Dr. Good and a lot of
That's who he sees.
Oh, yeah. Yeah, so, and we just get a consent, we coordinate with her, and, yeah, I mean, again, it's whatever's best for the child, so we don't want them to lose that relationship, so.
Okay,
Yeah.
thank you.
I'm just gonna jump on that, not to jump in also, but that was a really good question, and I will go back and just kind of add on to that a little bit, is what you asked was really good, and that was kind of what case management, either adult or children, I was talking about earlier, because there are options out there that you wouldn't be aware of, because you are set up with services now. So for anybody, not just you, but anybody that you would know or anyone that's here this evening, case management is a good resource for that, because we don't provide a service, we're not a service provider per se, but we are there to say, well, this is a service that's available, this is a service that's available, and so we're just kind of there to give you your options, and then you can make the choice from that. So be it an adult case management, be it a child's case management, that's kind of the gist of case management, is what your question was.
And there's an agency that's not here this evening, they're called the Youth Service Bureau. They do an awful lot within the community. They have parent groups, they do social skills groups. They really try to get kids out in the community, interacting, learning some of those appropriate skills. They're web-based, you can always just hop on, look up the Youth Service Bureau. This actually sounds like a really great CASP referral, was Paula just whispered to me, because you are going to get a lot of these service providers around the table that can really give some great ideas and support and things along those lines. So that is a great question, because you can pose that to CASP and you would get a ton of different services and supports.
So as a parent, there's some services here tonight, but there's a lot more, like you said, that didn't make it here. And a parent that's new to this or has a young child and gets confused and says, who do I call, what number do I go to? Where's my starting point as a parent then for that person?
You can, technically I think we still use the base service unit. And then that's that, we have a case manager who answers the phone every day, and they answer a lot of those questions. I'm new to the area, where do I start, what services are out there, and they talk about all of these services. You know, sometimes it's come in, we'll get you open with case management depending on the level of need. They help refer out for medical assistance, they'll walk through that process. A lot of times we do open them for administrative case management, and that just gives that extra voice to kind of help coordinate, learn the area. 9 chances out of 10, we're going to bump up to a higher level of case management. We can really work out in the community with the schools and things along those lines. So pretty much still use the base service unit, and we can kind of direct people in that way.
And I think the good thing about, and I know I can probably speak for everyone up here, is we work really well as a team. So if I see that I have a kiddo that needs a higher level of care, I'm calling all of these people and saying, help me, where do we go? And I know definitely Strawberry Fields in the base service unit for case management. I love my kids to have a case manager because it makes my job a lot easier. So I'm constantly referring out to other people. So if there's questions or concerns and you call any agency up here, we're going to help get you to the right place.
And I can really applaud all of our service providers, because my cohorts in other counties don't have this. It's very hard for them, especially in the joinders, to get person A to talk to person B, or even all be around the same table. So I applaud all of our providers, and you're gonna get a lot more than that. I mean, I can't even begin to tell you the amount of services and supports that we have, but that is the one great thing, is we have a very strong communication, provider-based, that makes my job and everybody else's job so much easier when we do have this open communication.
One agency that is not here this evening is the Office of Vocational Rehabilitation. And Paul, you talked about skills, and that's an agency that often works with students once they get out of school with more intellectual disabilities in terms of finding employment and such. We don't have, the Office of Vocational Rehabilitation does come to our IEP meetings for those students who are getting ready to graduate, works with parents, they give out their information. But my question also is for our students of transition age who would be 14 years of age or older. Are there any other services for parents other than the Office of Vocational Rehabilitation that we could access in terms of looking at employment or services after school as we begin to prepare students for life after high school? And that would also be not just for kids with disabilities, but also for the general population. If a student maybe has a mental health need, what about finding a job? What services are there for those students?
I would say, Gina, that for the mental health piece of it, I'll just talk about the mental health piece and just a little bit about the employment piece is case management in the adult system. So we kind of focused on the children's system today, but in the adult system, we also have blended case management, and the county has blended case management for adults who have mental health diagnosis. And we're really looking at that, even though we don't provide employment, we're looking at what they would like to do with their lives, what type of job would they like to have, where would they like to live, what services do they need to be successful to live independently, because no different than the rest of us, then no one wants to live with their parents for the rest of their lives. So, you know, how are we going to set them up to be successful? At Strawberry Fields, we have a CRR program, which is a community residential rehabilitation program. There's a short term, somewhere between a year to 18 months. You live in a group home, you learn budgeting, independent living skills, cooking, how to navigate the system, and then you move out independently. There's also a program called Clubhouse in State College that's run by the Skills Agency, and they do have a piece of employment that is attached to their program. So it's a day program. You go during the daytime. They have work that happens at their program to build your skills, and then they have temporary employment that you go out into different agencies in Center County, build your resume, learn how to work independently while you have support, and then go out into the community and get employment. So that's just kind of a few programs in the adult system for mental health consumers, and there may be other stuff, Paul, that I'm not familiar with for the ID side, or if you guys are thinking of something else, but
we do have a clubhouse. It's a psychiatric rehabilitation program. Anybody 18 and older can start that, and part of what that is it's a very structured day, and they focus on like education, employment, and things along those lines, so they can actually help 18 and up really kind of hone in on those skills. They can do a job assessment. They're linked very closely with OBR as well, and then they also have like a temporary employment program where they can like kind of job coach and go in and actually learn the job, and help the individual really hone in on those skills. I think there's another one and I'm blanking on it. I wanted to touch on Clubhouse because that's one. In our office with our ACMs, which I didn't touch on, we have a couple ACMs who are specialized. We have a forensic-based ACM case manager who works with the probation system as well as our county jail. So she works with both children, adolescents, and adults. And we have a transition age ACM who starts working with individuals 16 and up. So she kind of helps prepare them for the adult world and really kind of focus on, you know, what do you want to do, whether that be working, schooling, and stuff like that. And then she can kind of help direct out from there as well.
There's also site-based psychiatric rehab where individuals can go and learn skills to live independently. There's mobile psych rehab that can go to the person's home and help. So there are some services once they hit 18 that are out there. OBRs in the VSU office, counselors there. They're at CareerLink. They can hook people up with those kinds of things too.
Don't forget about the CareerLink office, and they do offer classes to help students learn specific things. It's a generic resource that any student or any citizen can access. Dr. MacFalls mentioned that we work with Skills, and they do our pre-vocational program, and they do supported employment as well. They're one of our providers. And the ARC of Center County also does supported employment for us as well. And we typically look at OVR as kind of the funder of the first place we look for funding for employment services. Once that funding has been exhausted, we can certainly look at using our ID funding to allow the individual to work with Skills or the ARC or any other qualified provider for that matter to fund supported employment.
One of the things, there are a lot of brochures and a lot of cards up there, and what we'll do, the district will do, is take those brochures, have them scanned and put them electronically onto a website that Dr. MacFalls and the group is actually putting together, that with the video that we have, so other parents that couldn't make it tonight that would like to watch it, or if you need to go back and refresh any of the information, but those brochures, we will scan those in, we will put those electronically. If the people on the panel have them electronically instead of just the paper and could send them to us, that would be wonderful, and then we don't lose some of the clarity of your training.
If no one else has any questions, what I'd like to do is give you all an opportunity to look at the brochures and talk with the panel members that are here. We have about a half hour to 40 minutes left, so this would be your time to just interact with one another. So I thank you for coming this evening. As Dr. Pottinger said, we will gladly take all of this information, scan it, put it on our website, and if you have questions or concerns, you may certainly address any of these folks here. So thank you for your time this evening. Thank you.